Hi, my name is Heidi. I'm a level 1 nursing student. My clinical instructor has assigned me to you to observe your actions today.
Excellent. Feel free to ask any questions you might have.
Great. Thank you so much. I look forward to learning a lot. So you're taking care of patient in room 622. Do you have time to give me a report?
Sure. In room 622, we have patient Ronald Jarvis. He's a 67-year-old African-American male with complaints of stage 2 pressure ulcer on his right heel. He's noticed it for approximately 3 weeks. He states it's been getting increasingly worse and more painful. He also complains of difficulty managing his diabetes. He's tried to follow the 1800 ADA diabetic diet, and he's been having a little trouble adhering to it. So his glucose levels have been increasing, and in the past 5 days, they've been in the 300 levels. So he was admitted for management of diabetes and the stage 2 pressure ulcer. He has no known allergies. His vital signs, let's see, he had a temperature of 98.4, respirations of 18, blood pressure 145/72. He is sitting at 95% on room air. His admission weight was 171 pounds, and he is 5 feet 11 inches. He's awake, alert, and oriented ×3, cooperative with the exam, and no visible distress. His speech is clear, posture is upright, gait is steady. Patient is well groomed and appropriate during the exam. His S1 and S2 heart sounds appreciated without murmur, rub, or gallop. Regular rate and rhythm, no carotid bruit. His lung sounds were clear in all 4 quadrants. His abdomen is soft, non-tender ×4 with bowel sounds in all 4 quadrants. His ulcer is 5.5 centimeters by 2.5 centimeters in diameter and approximately 3 centimeters deep, extending into the dermis. The wound base is pink. There's no tunneling or undermining noted. And there is moderate serosanguinous exudate. We put a constat out for a wound care nurse, and he has orders for dressing changes twice a day. And with the exception to the ulcer, the rest of his skin is warm and dry and proper color and elasticity. He was given morphine for his pain from his ulcer, which decreased his pain from a 6 out of 10 to a 1 out of 10. His hematocrit and red blood count were slightly decreased, so we're still waiting from some more lab results to complete. And we're going to continue to monitor his glucose levels along with his wound healing process. As of right now, he's got a medication, glargine due.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration and then watch you demonstrate that process?
No problem at all. What questions do you have?
Why specifically is this client receiving this medication, and what effects does it have on the body?
Well, Heidi, the patient has type 1 diabetes, and he has been having trouble controlling his blood glucose levels. His last capillary blood glucose taken at 2030 was 242. Glargine lowers the blood glucose levels by stimulating glucose uptake in the skeletal muscle and fat, inhibiting hepatic glucose production.
When should you question administering this medication?
You should question administering the medication if the patient's blood glucose levels are within normal limits. Also, if the patient is on beta blockers, clonidine, or risperidine, because these medications may mask some of the signs and symptoms of hypoglycemia. It's important to know if the patient has taken corticosteroids, thyroid supplements, estrogens, isoniazid, niacin, phenothiazides, and rifampin, because they may increase insulin requirements.
Does this medication have a therapeutic serum level?
No, it's a standing order. The amount of insulin is ordered to be given at a set time of day in a set amount of units.
Good to know. Which vital signs must I monitor?
The heart rate, the respirations, skin conditions such as color and diaphoresis.
Which physiological parameters should be monitored when the medication is being administered?
You would want to assess a patient for signs and symptoms of hypoglycemia, such as anxiety, restlessness, tingling in the hands and or feet, tingling in the lips and the tongue, chills, cold sweats, confusion, cool, pale skin.
What interventions must be taught to the client to ensure this medication is administered safely in the hospital setting?
In the hospital setting, it's important to teach the client how to recognize the signs and symptoms of hyperglycemia and hypoglycemia, and the importance of alerting someone at the first onset of these symptoms.
And what setting, what interventions will be taught at home?
At home, you'd want to make sure that the client knows how to properly test his blood glucose. He also needs to know about proper dosing, administration, and proper storage of the insulin.
Okay. And what side effects and potential adverse reactions could happen?
Hypoglycemia, if he's given too much insulin, erythemia, lipodystrophy, pruritus, swelling, and allergic reactions.
Okay. How will you know this medication is effective?
The patient's capillary blood glucose will decrease to an appropriate level. The patient will no longer exhibit signs and symptoms of hyper or hypoglycemia. Do you have any more questions for me before we go in and administer the patient their medication?
No, thank you so much for answering all my questions.
Not a problem at all. It's important to know your patient and the medication you're administering to keep your patient safe.
I agree.
Hello, my name is Karis. I'm going to be your nurse tonight, and this is Heidi. She's a student from St. Petersburg College. She's going to be observing me tonight. I'm going to administer your insulin largely tonight. Do you have any questions about it? No? Okay. Can you tell me what your first and last name is and your date of birth? Okay. Do you have any allergies? No. Wonderful. Okay. So, there's the two. Just don't share the word.
No, it's not that big.
Thank you so much for answering all my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any further question on the anything. I am going to take some time now and document the patient.
Hey, Mr. Lutz, how you doing tonight?
Check the temperature, the color, the medication.
Hey, Mr. Lutz, how you doing tonight?
It's a proper
Good.
medication.
Doing all right.
And I'm sure you've heard
So
of
I'm here to give you your
five
insulin and
rights.
pH.
Mhm.
All right. Can you
Five
just tell me
rights
your name
of
and date of birth?
medication
All right.
administration.
Do you have any allergies?
You have the right patient,
So you just go
the
to
right medication,
compare
right
her name
dose,
to the
right
mark
time,
and
and the right route. Okay.
then she's due for
First
her
thing you do
intake. So
is scan his
Why are you
Okay.
taking my photo?
and then
Oh, I'm just.
select the medication.
all right, so we're gonna scan the band.
Okay. And so this is just another check that we do to make sure that we have the proper medication.
I bought this one
You want to
for
make sure.
$4. I'll break it down. Hey, John, what do you expect?
All right, then Greg just popped up. So then, since this hasn't been working, you gotta enter the barcode in on the bit.
To submit the final one.
Okay.
So just click right here.
First thing we're going to aspirate it down to 18.
You know how to say LPDF, right? Yes. What are you doing now? Glucose of all the-
Make sure that the one is directly on the 18 units. And then when you're recounting the meal, it's really important. You don't want to hold it and stick it on. So you
Alright,
do
so it
what
said
we call the
verify.
scoop method.
So you can now draw up the insulin.
Okay, Mr. Jarvis, I'm going to expose your stomach now. And make sure that you clean up the area really well. You want to go within 2 inches of the umbilicus.
Sure, no problem.
Pinch the skin.
Record it on your phone or?
And then goes directly into the sharp.
So we're given
Great.
20 units.
Mr.
Pull it back to
Jarvis,
the
you
point.
have your meal right here. Is there anything else you need? Okay.
On the vial.
I will be back in a little bit to check on you then.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions if you don't mind.
Sure.
Were there any pertinent pieces of information you were reviewing before administering the medication?
Well, it's important to check the patient's glucose levels before administering insulin. If the levels are too low or if too much insulin is administered, it could cause the patient's glucose levels to decrease to dangerous levels. It can cause a patient to become hypovolemic and hypoglycemic and go into shock.
Okay. So did this information affect your decision to administer this medication today?
As a nurse for a patient, it's important to take caution when administering any kind of medication. However, the blood glucose levels were within the parameters to safely administer this medication.
How about the actual administration part? Did the information affect that?
No, I administered the medication as it was ordered.
Okay, great. Thank you so much for answering all my questions. I really feel like I learned a lot today.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take a few minutes now and document the teaching that I provided to the patient and any other things that I did in the patient's room. Do you want to observe me documenting as well?
Sure, that'd be great. Thank you.
Okay.